And thank you for all being here as we discuss the largest investment in rural health care in American history. This is the big one. As part of the great big beautiful bill, we have increased funding for the health care by an unprecedented $50 billion. That's rural health care. Nobody thought that was going to happen, and we got it done. So we have rural health care for those that were trying to make a case that we weren't taking care of the rural community. I'm all about the rural community. We won the rural communities by numbers that nobody's ever won them before, and we're taking care of those great people. So we already did this. We increased funding for rural health care by an unprecedented, record-setting $50 billion over 5 years, which will benefit Americans in all 50 states. And this was made possible by cutting massive waste, fraud, and abuse from Medicaid and reinvesting those funds to revitalize hospitals and our cherished rural communities and hospitals in rural communities. And I want to say, with all of the fraud that we're seeing in Minnesota and California and other places, I actually think that if we do an unbelievable job, you could almost balance your budget, Kevin. If you take a look at the kind of numbers you're talking about, nobody ever saw anything like it. They're all corrupt politicians, from the governor of Minnesota to the governor of California to everybody. They're just corrupt politicians. Under the Unaffordable Care Act, which is Obamacare, it's called the unaffordable. It is unaffordable. Remember that. Rural hospitals in communities were devastated by soaring costs, and that continues. Despite colossal increases in government spending since Obamacare was passed, only 7% of the annual Medicaid spending on rural hospitals has gone to rural hospitals. So there's only a very little. They didn't care. Obama didn't care about the rural community, to be totally blunt. What he did care about is insurance companies. As a result, rural health care facilities have suffered from low occupancy rates, workforce shortages, and failing programs that put Band-Aids, literally put Band-Aids over the problems in those communities. And we're not going to have that. We're taking great care of them. With the Rural Health Transformation Program, we are getting rural communities the health support they need, and we're getting it immediately. These funds will go to empowering rural hospitals, strengthening their workforce, modernizing facilities and technology, and ensuring that rural Americans get world-class health care in their own community. Every single Democrat in Congress voted against the lifeline for rural communities, and I hope everyone knows this, and this is not about elections, but I hope you remember this in the midterms, because the Democrats are just so horrible toward the rural community. Yesterday, I also announced our framework to lower health care prices for all Americans, including those in rural America, and we're calling it the Great Health Care Plan.